All right, good evening, everybody. I'm Kyle Johnson. I'll be instructing you tonight on part of the essentials of firefighting, the first aid provider. We're going to go over some BLS items. The training will be recorded tonight. Exits here. All you know, the restrooms are outside in the bay. So if anybody has any questions or concerns, let's go ahead and get started. Get through this without any difficulties. All right, so the first objective tonight, we're going to describe the role of fire service in providing EMS care. Okay, as we all know, EMS is a pretty vital part of the communities. Where we service first responders is treatment on scene, and then we wait for the transport from either Higginsville or mutual aid company to a hospital. 3 different types of ambulance services. We got the fire service, which is like Snide Valley, CJC, you know, everything's housed and controlled under one. Hospital based, not too many around here. Golden Valley down in Clinton, hospital where the ambulances ran out of the hospital. And then the private party ambulances such as AMR and some private ambulances around the city. So what we're going to do is become familiar with equipment protocols and each standard of care with each patient. We've been doing a pretty good job of cross-training with EMS lately. Just know where stuff is on the ambulance, how to work the stretchers, and where, you know, most commonly found items needed are on the ambulance. So what we have here with our EMS system is we have a paramedic EMT usually on each shift. Read question. What kind of role do we play as a fire department in the EMS system? Drew?
I'd say it's supporting role.
I would say in between.
Right.
People until they get the.
First respond, get there on scene, give a quick assessment until the ambulance gets there. What level of EMS care does our fire department provide? EMR, or, you know, the select few that are EMTs with both. Here's a big one. Patient confidentiality, HIPAA, you know, big thing. It is a law. We have to secure all records, names, medical issues, everything with that patient, okay? After a call, you can't just go run around town, hey, you know, so-and-so has hepatitis. You know, it's not a good look, it doesn't help anything, okay? Like our reports we give to the incoming ambulance, you know, copy for them, copy for us, it goes in our record, it goes away. Okay, that's how it needs to stay. Okay, be discreet. Don't be running outside yelling, hey, so-and-so got this. Okay, and only tell the lead provider or supporting provider on the ambulance. Okay. Who has the right to patient information? It really depends on what the patient wants us to know, right? If they don't feel comfortable telling us some things, they're not going to tell us. They may tell EMS more as they get in the ambulance. All right, communicable diseases. So we go to a call, what's the first thing we do? Glove up, okay? BSIC say, body substance isolations. Okay, keeps whatever germs we have on us, on our hands, as we handle the patient, and then just the safety of cross-contamination and passing of diseases. Hepatitis, inflammation in the liver. pretty common condition. Drugs, alcohol, chemicals, and hereditary are the causes. Hepatitis A. So if somebody has hepatitis and drinks contaminated food or water passed along, they can spread it. Okay. Fatigue, abdominal pain, fever, dark hair, yelling, eyes or skin. Some signs and symptoms. Hepatitis B, transmitted through bodily fluids, blood, spit. Short-term, long-term, can progress into liver failure. C and D, liver damage, liver failure. And D is pretty uncommon. Usually only get that if you have hepatitis B previous. There are vaccines, A, B, and C. I know for us to graduate high school, we had to have all three. But it is a good idea to get immunized to help control the spread.
Cindy used to offer that.
They used to
for us.
offer
I think for us, you know, in the sewer, within the sewer side of things, we got it, the city provided. I don't know, since we're the fire department, no longer part of the city, I doubt we.
'Cause they did it, yeah, they did it
Buy
for the
them.
fire department one time, because we all went through the auditors.
Moving on to tuberculosis is a bacterial infection. It will affect the respiratory system. It is contagious. We see it a lot in the highly populated areas. Signs and symptoms: fever, fatigue, chills, weight loss, painful breathing, and productive coughs that last several weeks. BSI again, your gloves, your mask if you need to. People that aren't vaccinated. HIV/AIDS. A weakened immune system to where it won't fight off the diseases. Those are early symptoms of other things. Cause muscle wasting and increased chance of contracting something else. You spread it through contact with infected blood and bodily fluids. All right, so we get on scene and we use a blood pressure cuff, stethoscope, and we help with the stretcher. What should be decontaminated after each call? Wash your hands, wipe down everything, wipe down the bag, because you never know what you're gonna set that bag in. Multi-drug resistant organisms, difficult to control, typically do not respond with antibiotics. Staph infections, MRSA. These occur a lot in the healthcare, hospitals, nursing homes, long care facilities, easily spread. Again, BSI, PPE, seems safe. H1N1s, swine flu, influenza, bird flu. Dealing with COVID now, the flu, getting over all that. Okay, exposure. Make sure you get tested. You know, if there is a chance, hepatitis, flu, get your flu shot, get tested, TB tests with your primary care physician. 3 communicable diseases: tuberculosis, hepatitis, HIV. Ways to prevent the spread. All these we just seen. BSI, so keep your gloves, your masks. New thing is eye protection, safety goggles, face shields, somebody spits, coughs in your face, it will enter through the eye. You can catch it that way, through your mouth. And then bloodborne, we talked the other day about getting the blood sugar from the needle, the IV needle, hitting it on the table like everybody used to, just push it, that way the blood's not getting thrown into the air. Exposure, we keep the cuts and everything covered, no sores, no open wounds. There again was your eyes, nose, and mouth, and then dry skin where it cracks. Hand washing, PPE, and then disposing of those old used items. Everybody knows how to wash their hands. Greatly reduces disease. Do it frequently. Warm water soap. Wash your wrists and your forearms, scrub pads, and wash them for at least 30 seconds with hot water. PPE. Adequate PPE to prevent infectious diseases and adjust your level. If we go on a call, little old lady fell, we probably don't need the gown up, mask up, goggle up. Okay. Until unless you get there and you're like, oh, turn into something else. Again, too much PPE is better than not enough. Gloves. Every call we run on, we should be wearing gloves. Okay. Latex or vinyl. A lot of people have latex allergies, so we use the vinyl gloves a lot. And then each patient should get a new pair of gloves so you don't transmit a disease, possibility of disease. Remove 2 clean fingers, pull them off one by one, inside out, and then dispose them into the biohazard. If it's a bloody scene, that's where you want to put your mask and your eye protection on. It keeps all the blood and airborne out of your eyes. Helmet shields, eye shields do not necessarily keep everything from your eyes. They can go under it, above it.